my name is Catherine Haken. This is my Category 2 SOT video. We would know we were going to do Category 2 for a patient if we had a positive arm fossa test. First, we're going to start the video off with a supine leg length check, and just going to approximate the heels together and checking the height of the medial malleoli. And his right leg is going to be his short leg. And what we do, we have to find congruency within these tests to be able to block a patient for Category 2. And there's three things that we have to do to correlate in order to block. So if we had an upper fossa weakness when we did arm fossa tests, then we would correlate that to medial knee pain on the short leg side. Now if we had a lower fossa that went weak, we'd correlate that with lateral knee pain on the long leg side. And then from there, we would go, if there's not any congruency, then we need to check for an upper cervical problem or possibly a lumbar problem before we move on. So all our blocking for Category 2 is done supine. And this actually can be done actively as opposed to Category 1. So since this is his short leg side, we're going to have the SOT board 4 inches above the iliac crest to start. And then our goal while we're blocking is to strengthen all 4 fossas. And so here I'm going to have him go ahead and roll. And I'm going to place that on the lumbar paraspinal musculature and then on the iliac crest on the short leg side. And then over here, I'm going to angle it up 45 degrees right in the area of the greater trochanter and have him go down. Okay, so like I said, perpendicular on the short leg side, and then at the acetabulum at 45 degrees on the long leg side. And from here, our maximum blocking time is 2 minutes. So after about 30 seconds, if our fossas aren't stabilizing, we're going to go to blocking augmentation. And from here, we're going to first start and wiggle the blocks. That way we think they're properly set for the patient. And then after that, if our fossas aren't, or they're not becoming strong, we'll go to bilateral thigh pressure, which is below the level of the blocks. And then I'm just going to apply ADP pressure for about 10 seconds. And then I would recheck. Now, if they're also still weak, I would go to diagonal pressure, which I would go up to the area of like the ASISs away from the blocks, apply ADP pressure for 10 seconds. And then if that doesn't work, we're going to go to the cranial fault, which is basic 2. And here we're going to use the arm fossa test to test whether on inhalation or exhalation there is weakness. So Skylar, I'm going to go ahead and put your arm up in the air, and then I'm going to take a deep breath in, and I pull, and then exhale, and then also pull. And if any of those are weak, so say on inhalation the muscle test went weak. So that means I would fix him on exhalation. And I'm going to instruct the patient to place his tongue on the top palate of his mouth and apply pressure there, as well as dorsiflex his feet as he inhales. As he exhales, he's going to let go of the pressure on his tongue and plantar flex. And while he's doing that and practicing, I'm going to just hold the head posterior side and the anterior side. And then, so he had an inhalation fault, so during exhalation, I would apply I to S traction as he dorsiflexed and put his tongue on the roof of his mouth, and then relax on inhalation. And I do that approximately 3 times. Now, if he had an if he had an exhalation fault, I would correct it on inhalation by applying S to I pressure while they inhale. So after that, we're going to do a reverse arm fossa test to make sure that we lock in everything that we just fixed. So we would do that right there. And after that, we're going to our post-blocking techniques. And we have to do this in case the legs are still uneven. So first we would go to the short leg, long leg technique. And we do this by go ahead and flexing the short leg side first. And then we're going to bring it lateral, medial, and down. And we do this about 3 times, lateral, medial, and down. And we're just trying to set the femur into the acetabulum. And then, after we do that about 3 to 5 times, we're going to flex the long leg, and we're going to bring it medial first, and then lateral, and down. We're just going to do this approximately 3 to 5 times as well. And so, after we do that, we would also check the legs again to make sure that they're balanced. If they are not, we're going to have our patient flip over. And so, Sky, go ahead and flip over. And we would go to our sacral cup analysis. From here, we're going to address if there's a sacral issue causing the legs not to balance. And so I'm going to have the patient lift up one leg at a time, about 30 degrees, and I'm going to apply pressure and see if he's able to maintain that muscle test, grade 5. And then I'm going to have him do the other leg and also push down. Okay. Now, if one of those goes weak, well, if both of them are strong, this whole analysis of the sacral cup is not indicated. But if one of them does go weak, I'm going to find 2 points on the sacrum, that side, above and below S2. And as I push, I'm going to have to test the side. And if that stays strong, I'd go to the other one. And if that one went weak, then it would be indicated that my other one, I needed to apply pressure, P to A pressure for about 5 to 10 seconds in that area. Okay, so I would do that, apply 5 to 10 seconds of pressure, and then I would retest those 2 areas, making sure that they both stayed strong. And after that, we would do another leg length analysis. Hopefully everything is great, and that would be conclusion of our category 2.